Med Society has been a champion and advocate for access to care for underserved populations in our community.
The Medical Society obviously has contacts with a lot of physicians, and so it's a key communication vehicle.
Is that it has always been a group of individuals who understand that they got into healthcare so that they could help people.
I think to a clinician there's incredible value. The Medical Society does a lot of great things. They have clinics, they offer medications, they do the kind of community service things that every doctor should want to support.
The Medical Society of Milwaukee County leads numerous initiatives to improve health care for people across the community.
The Medical Society was founded in 1846, which means we have nearly a 170-year legacy of physicians helping to serve the Milwaukee community. Pioneer physicians founded the Medical Society as a means to present papers and breakthroughs in scientific medicine. As the society has evolved, physicians are tackling issues of public policy, ranging from tuberculosis in 1904 to healthcare reform and health literacy in the present day.
Today, the Medical Society leads initiatives focused on patient and prescription drug safety, immunizations, emergency medicine, and specialty care for the uninsured. Medical Society board member Dr. Madeline Tully is a family physician at Progressive Health Center in Milwaukee.
There's a great disparity among folks who have insurance and people who don't have insurance, and the Medical Society has done a lot to try to bridge that gap for the folks who really need it.
James Nauwerts of Milwaukee is an example of one patient who has received that help.
I started getting blurred. I was actually blind in one eye before I even knew it.
James came to Progressive Healthcare. Cataracts had taken away his vision and his freedom.
I didn't have insurance and I didn't have the money, so I went to try to get assistance, and I tried everything. I tried the city, the state, I tried like the Lions Club, any kind of charity care, anybody that would help me, and I couldn't get help anywhere.
The support and care he received, thanks to Medical Society volunteers, transformed his life.
I can see better than I have since I was in grade school. I've got 20/25 in one eye and 20/30 in the other now. So it's amazing.
I've been treating uninsured patients in the Bread of Healing Clinic for 13 years. For the first 12 of those years, we had real trouble getting our patients specialty care.
Tom Jackson sees the effect of the Medical Society's work nearly every day.
The specialty care for the uninsured program was a critical need that clinics who deal with the uninsured have identified for years. The Medical Society has been extremely helpful there in publicizing the program and actively recruiting over the last several years. They helped us develop a special webpage to recruit volunteers.
The Medical Society has sponsored and worked with the Free Clinic Collaborative to create a physician volunteer recruitment website. Joy Tapper says it gets more physicians involved in this important work.
It profiles 25 free clinics in our community. It has testimonials of physician and other volunteers who are working at those clinics, and it allows physicians and other providers to think about how they might contribute and participate in the care.
And we've recruited well over 50 volunteer physicians to do specialty care and primary care in our free clinics.
I think it's just another example of how the Med Society is responding to the interests and needs of its members and at the same time serving the needs of the community.
At the Milwaukee County Medical Examiner's Office, another program brings doctors together with students. Medical Society board member Dr. Brian Peterson mentors medical students in forensic pathology.
The Society has a mentorship program. So the idea is that an undergraduate who's thinking about medicine as a career in general, perhaps thinking about forensic pathology in specific, can actually come and spend some time with me.
Dr. Peterson's current protege is Christine Rominski, a student at the University of Wisconsin-Milwaukee.
When I saw forensic pathology, and I'm like, oh, this might be like my once-in-a-lifetime chance to shadow a forensic pathologist, so I just kind of applied and waited to see what happened, and I got paired with a forensic pathologist, and it's been awesome so far.
Yeah, they get a chance to see it in advance. They haven't made any life-changing decisions yet, but they get a chance to see if perhaps a specific field of medicine is a good fit for them.
We really appreciate the work of the Med Society, and without their support, we probably wouldn't be seeing the progress that we've seen.
when we can come together, share our stories as their providers and get strength from each other, we're more likely to enjoy our jobs and more likely to find better, more creative solutions for our patients.
If we don't have this collaboration, things aren't going to work. It's extremely important to have the Medical Society being such an active partner with our attempts here at the city, for example, to reduce health disparities, because we know in this city and in this region that there are a lot of people who don't have access to health care or can't afford health care.
Well, there's so much the Medical Society does and so much more that it could do if there are more people to help.
The Medical Society of Milwaukee County has shaped lives, health, and history, creating a more promising future for people across the community.